Hello all, this is Dr. Sue with part 2 of our discussion this week about dehydration. In our previous discussion, we looked a little bit about how we diagnose different degrees of dehydration and touched on some of the things that parents will see at home when that starts to be something of a concern. Now, I want to start talking about when our little ones stop taking in fluids or when they are vomiting and we are starting to see decreased urination, we're starting to see possibly dry lips, or we're really just trying hard to prevent symptoms of dehydration. Now, again, the first thing families will start to see is the dryness of the lips, the sunken eyes, decreased urination, and, parents know when their children aren't drinking well, particularly when they're infants and they're breastfeeding or they're bottle feeding. We always generally have an idea of how much we're feeding them, whether it's frequency of breastfeeding or whether it's the amount of volume in the bottles, but we always have an idea when we're at the point where we're worried that could be something that happens as these kiddos get over the illness. So when we start to notice that there's decreased intake or there is vomiting, the first thing I want to mention is we talk to families about trying to give more frequent feeds with less volume. Oftentimes that can mean that either breastfeeding happens more frequently as the little ones tend to be a little more tired when they're sick. So I always tell families breastfeed as often as you can. Continue to read your baby's cues. With regard to older children, making sure that you always have fluids available to them and making sure that you kind of keep an eye on how much they are taking. When we aren't feeling good, oftentimes we just aren't great at drinking, particularly when we have fevers. So managing those fevers is going to be key, as well, because that's going to make it so we don't feel so sick and tired and we want to go ahead and keep drinking. So in terms of use of products, popsicles are a huge asset when children aren't taking good fluids, they're not wanting to eat. So when we are ill and we are finding that our kids aren't wanting to drink and they're not wanting to eat, that's when we want to make sure we get something in their tummies that has some sugar in it. And some of the electrolytes that are found in Pedialyte, the sodium and the potassium, as well as in Gatorade and Body Armor, those are super helpful too. So that's kind of where things are a little bit different with kiddos that have decreased intake versus kiddos that can't seem to keep in what they take because they're vomiting. So let's start with the kids that are vomiting. Those are kiddos that we want to minimize or limit fully the amount of dairy they take, because dairy is very irritating to tummies that are already dealing with inflammation from a virus. So I tell families, stop giving the milk. If they're taking formula, then Pedialyte is perfect. Now, breast milk is not dairy, but sometimes it can be a little harder on the tummies too because it's thicker. So even kiddos that breastfeed can do well on Pedialyte. There's lots of different I'm saying Pedialyte, but that's just a brand name. There's lots of alternatives that are very similar, so please keep that in mind, that you can use the alternatives as well. So with kiddos that are vomiting, we want to make sure we let our pediatrician know, and that pediatrician will help to manage this as well. But I want you to know that if they're vomiting, try something that's clear, something that has some sugar and some electrolytes in it, even popsicles, Pedialyte, Body Armor, Gatorade, all of that. And you would be surprised at how much better these kids can do when we offer them clear fluids. Now, oftentimes families will think that water is a great way to keep our kids hydrated. Well, it's interesting because when families do just give water and the kiddos aren't eating very well and they are vomiting, water is not something that's always helpful. And unfortunately, that's our first instinct, is to give our children water when they're showing signs of vomiting or decreased intake. So I often tell families, let's do this. Let's start with something clear, but more, something that has more sugar, more electrolytes, and I can't tell you enough how oftentimes we can keep that down because it's just less irritating to tummies, and kids can do really well. When you feel like you are in trouble and you feel like no matter what you're offering, the little one is still throwing up, that is definitely a time to reach out again to your pediatrician. For kiddos of certain ages, we can offer some medications called Zofran that can help if it is something related to a tummy bug. But if it's something related to something more acute, such as some of these words you may not have heard of, such as intussusception, which can happen with children, it can also involve something more like an obstruction. There can also be, even appendicitis can cause us to vomit too. So don't try to manage that on your own. Make sure you reach out to your pediatrician, and oftentimes with just communication, they can help you understand what the best course of action would be. So with children that are not vomiting, but just decreased intake, managing those fevers, making sure to offer fluids at all times, not worrying about the solids, and oftentimes they like to also take popsicles and Pedialyte, Gatorade, and Body Armor. Those are all super great alternatives. And the other thing that I do mention is sometimes when the kids have decreased intake, it may be because of a tummy bug too. So if you start to notice vomiting, then you kind of go into that mode where you want to make sure to let your pediatrician know. Keep in mind too that, little ones that don't want to drink, it could be their tummy, it could be their throat, it could be where they're just tired. There's lots of different reasons for decreased intake. So that's something to know, that I don't expect you to figure this out on your own. I do want you to know how to deal with preventing dehydration and also managing it if you're starting to see some signs. When kids get in trouble, that's when we feel like they're just not drinking, they're not keeping things down, your pediatrician has been helping you. That's when we start to look at whether or not we need intravenous fluids. Now, I want you to know this. I often have families go to the urgent care and say, oh, well, I think we need IV fluids. Now, IV fluids are truly one of the worst case scenarios, because I can hydrate a child, but if they're not able to keep something down and they keep throwing up or they keep having decreased intake, that one fluid push is not going to matter quite as much. So I always tell families we want to try to use the tummy first and get these kids to be able to handle what they're taking in first. And that's one thing that we really try to make sure to let parents know. At the urgent care, we're only able to give, a fluid push. If a child is really that sick and needs constant fluids while we're trying to understand what's going on, then that is more of an emergency hospital admission child at that point. So again, that's not something I expect you to be able to decide, but that's something that we want to be able to help you with as your pediatric group. So keep in mind, that's when you go to the urgent care, we will always try something like Zofran. If the kiddo looks like there's nothing acute in that tummy going on, such as an obstruction or a surgical issue, then Zofran, 6 months and up, can often be the key. And, some families ask, well, is Zofran okay to use? And as long as there's no heart issues with the child, there's something called long QT syndrome that would be diagnosed by a cardiologist. That's something that we want to make sure that we always talk to families about. But in all honesty, Zofran has been wonderful to keep children out of the hospital. So I do want you to know that we oftentimes think of using medications because it does work on your vomiting center in your brain. It does help you keep things down easier and can oftentimes prevent a hospital admission. For children 6 months and under, we always try to make sure we're attuned to what this could be. Little ones are more apt to require hospitalization if they are showing signs of dehydration, and that's really because they just don't have the reserve. They're smaller. So, we look at kids 6 months and under a lot differently than we look at kids 6 months and over. So, in general, I hope this is helpful. Remember, I will always tell you liquids are much more important than solids, especially when children and adults are sick. So making sure that we hydrate, putting the solids away, and if your child is somebody who's really picky and won't drink very much of anything other than maybe milk, and they're vomiting that's where we can help you with that too. Your pediatric group, whoever you're with, can help you with that too. But don't forget to be creative. Applesauce is full of hydration. Watermelon is too. So using things, if they're not big drinkers, using foods that do have a good water percentage is going to be just as helpful. Many, many families have found that applesauce has been super helpful. It's tasty, it has sugar, and it also has lots and lots of water in it too. So don't forget to be creative. Always keep some popsicles in the home, and that way you'll be covered. And even if you have some Pedialyte, just grab some Pedialyte in the store next time, or an alternative to that, so you can be ready if you ever need that. I've always said to my staff, boy, I'd love to send Pedialyte home with every baby, just because it can be so helpful. And remember, it comes in unflavored as well as other flavors. A lot of the little ones tend to like the grape flavors. I'm not sure why, but they do, or the unflavored, because oftentimes infants just haven't had any taste yet because they've only been on breast milk or formula. So remember, you've got this. Your pediatrician is here for you, whether it's us or another pediatric group that's in our region or your community. Remember, we are here for you, and trust your gut and know that you've got this. All right. Have a great day, everybody.